Welcome back, guys. After discussing about the large vessel vasculitis, now let's discuss about the medium vessel vasculitis. Are you able to recollect what are the medium vessel vasculitis? The medium vessel vasculitis includes Polyarteritis Nodosa, Kawasaki Disease, as well as the Thromboangiitis obliterans, which is also called as the Buerger syndrome. Now, let's begin with the medium vessel vasculitis. The first medium vessel vasculitis which I want you to know is Polyarteritis Nodosa. See, there is a mnemonic which I invented myself. It's the Plan B, P-L-A-N-B. So, what exactly is this Plan B? See, in the Polyarteritis Nodosa, now itself I am telling you, in the Polyarteritis Nodosa, see, polyarteries are getting involved. Okay, polyarteries are getting involved. Polyarteritis with the nodosa, nodular development will be there. See, Polyarteritis Nodosa. What is this B stands for? This B stands for, see, this Polyarteritis Nodosa is something associated with the hepatitis B. Okay, so in most of the cases, hepatitis B surface antigen is going to be a positive. Okay, and one more thing, Polyarteritis Nodosa, is there, right? PAN. Remember, many arteries will be affected. Most of the arteries in the body are going to be affected, but the pulmonary arteries, this P, pulmonary artery is not affected. Okay, so Plan B, remember it as a mnemonic. So what is that Plan B? Polyarteritis Nodosa is associated with the hepatitis B. And what is this PAN stands for? Pulmonary artery is not affected, but the other arteries in the body can be affected. Okay, having said that, now let's write the important points. It's Polyarteritis Nodosa, it's an immune complex mediated vasculitis. Immune complex mediated vasculitis. Okay, because you can see the immune complexes, and it is going to be mainly seen in younger males. And one more important point which I want you to know is, already I have said you, in 30% of the PAN cases, okay, 30% of the PAN cases, they are associated with hepatitis B, and they are also associated with one more condition which is called as hairy cell leukemia, HCL. It's a cancer. Okay, it's a blood cancer. This 30% of the cases of the Polyarteritis Nodosa, they are associated with the hepatitis B condition, or hepatitis B surface antigen is going to be positive, and they are also associated with a cancer called as the hairy cell leukemia. What else you should know? And already I have taught you that in this Polyarteritis Nodosa, many arteries are affected, but pulmonary arteries are spared. Okay, see, in Polyarteritis Nodosa, many arteries are affected, but what is the most common artery that is going to be involved? Which arteries are most commonly involved? See, the most commonly involved arteries are going to be the renal arteries. Okay, the renal arteries are going to be most commonly involved. So, because of this renal artery involvement, the kidney, if you look at the kidney, it's going to have a flea-bitten kidney appearance. Okay, you can see here, I hope you can see. See, the kidneys are going to have this, all the spots, like the hemorrhages, small hemorrhages, which are also called as a flea-bitten appearance. So, what are the clinical features that are going to be there? The clinical features of these patients include the fever. The clinical features, there will be fever will be there, weight loss will be there. Okay, these are all non-specific symptoms, fever, weight loss, and because of the involvement of the cerebral blood vessels, there will be neurological involvements. Okay, there will be neurological involvement. So, renal arteries are going to be affected, but important point which I want you to know is, see, there won't be any glomerulonephritis. Renal arteries are involved, but there won't be damage leading to loss of blood in the urine. Okay, so glomerulonephritis is not going to be seen. That's a very important point. See, under the renal arteries, flea-bitten appearance is seen, but no hematuria. Hematuria is not going to be seen. So that's the MCQ. No hematuria, no glomerulonephritis. Okay. Now, after this, what else you should know? This Polyarteritis Nodosa, is it associated with any ANCA? No ANCA. So not associated with ANCA. Okay. ANCA association is going to be negative. If you look under the microscopic examination, see, it is a necrotizing vasculitis. Previously, when I am discussing about the large vessel vasculitis, I have stressed this point that the temporal arteritis and arteritis, they are the granulomatous vasculitis, but this polyarteritis nodosa, it is necrotizing. There will be necrotizing transmural, means throughout the wall, all the layers of the blood vessel, okay, all the layers of the blood vessel, the 3 layers of the blood vessel is going to be affected. So it's a necrotizing transmural, it's a transmural inflammation. Okay, necrotizing transmural inflammation. See, it's a necrosis is happening, especially in the blood vessels. So there will be fibrinous deposition. If you look under the microscopy, there will be fibrinous deposition. This pink color deposition is going to be there. So it's an example of fibrinoid necrosis. Okay, there will be fibrinoid necrosis. Okay, and why it is called as a polyarteritis nodosa? Why? Because you can see this and this arteriogram. Okay, you can see this a nodular involvement. Okay, on this arteriogram, you can see this nodular involvement. This is also called as the string of bead appearance. String of beads appearance is seen on the renal artery arteriogram. Okay, so what are the important points which I want you to know regarding the polyarteritis nodosa? Remember, the first mnemonic is plan B. So what is that plan B? B stands for association. Hepatitis B surface antigen positivity can be seen in 30% of the cases. It is associated with which cancer? Hairy cell leukemia. So what kind of inflammation it is? It is the necrotizing transmural inflammation. Under the microscopy, you can see the hyalinous depositions, the pink color depositions are going to be seen. So which is an example of fibrinoid necrosis. Many arteries in the body can be affected, and the most common artery is going to be renal artery. Because of the involvement of the renal arteries, there can be a flea-bitten kidney, but there is no hematuria, no glomerulonephritis. Because of the involvement of the cerebral vasculature, there can be neurological involvements, but the pulmonary arteries are not going to be affected. Okay, so these are the important points which I want you to know. Yeah, you can look here because of the polyarteritis nodosa. It's a necrotizing inflammation, right? So you can see all this ulcerous, involvement also, ulcer formations also. Okay, now here as just an integration, okay, I want you to know, see this flea-bitten kidney, it is seen, yes, in polyarteritis nodosa, but not only in polyarteritis nodosa, this flea-bitten kidney, okay, let me write here, is also seen flea-bitten kidney is also seen in some other conditions. What are they? They are seen in malignant hypertension. I am little deviating from the topic because this is a bit important. Flea-bitten kidneys is seen in malignant hypertension. And yes, polyarteritis nodosa, you can see this, and hemolytic uremic syndrome, infective endocarditis, thrombocytopenic purpura, and rapidly progressive glomerulonephritis. So in these conditions, in all these conditions, malignant hypertension, polyarteritis nodosa, hemolytic uremic syndrome, infective endocarditis, thrombocytopenic purpura, rapidly progressive glomerulonephritis, Henoch-Schellen purpura, in all these conditions, you can have a flea-bitten kidney. Okay. Now, after this, what I want you to know, guys, look here, this is just like a mnemonic, just like a plan B. Okay, I have asked you to remember the plan B for polyarteritis nodosa. Now, look here, there is a small guy present. Okay, definitely not greater than 5 years. For example, imagine he is a 4-year-old guy. Okay, definitely, of course, he is not 4 years, but just remember. Now, what he is doing, he is riding a bike. Okay, Kawasaki Ninja bike. And how he is riding, he is having a beer bottle. Okay, the Corona beer is there. Okay, now imagine a 4-year-old kid taking a beer and riding a Kawasaki bike. What's going to happen? Definitely, this is not something good. Definitely, what he is going to do, he is going to crash the bike. Okay, so there will be a crash. So just use this as a mnemonic, okay, to frame the story. I am just showing you this. Okay, now Kawasaki disease. Now why I have shown you all this is because, see, this Kawasaki disease is something is first of all it starts something like this. It's also called as, okay, it's also called as mucocutaneous lymph node syndrome. Okay, so mucocutaneous lymph node syndrome. So in the name itself, it's mucocutaneous. The mucosal membranes and the skin is going to be involved. The mucosal membranes are going to be involved, and the lymph nodes in the baby and this boy are going to be affected. So mucocutaneous lymph node syndrome. Next, see, it's a pediatric vasculitis, guys. Pediatric vasculitis. Now, that's the reason why I have shown you a kid with a coronavir. So, pediatric vasculitis, and the most common age group that's going to be affected is less than 4 years. Okay, some books mention 4 years and some books mention 5 years, but okay. So, it's a pediatric vasculitis. Children less than 4 years are going to be most commonly affected. Same, there is inflammation of blood vessels. Which blood vessel? The most common blood vessel that's going to be affected in this condition is going to be coronary artery. So in the baby, coronary arteries is going to be affected. So because of the involvement of the coronary artery, this baby can develop myocardial infarction in such a small age. Not only that, the inflammation can also be affecting the mucous membranes. Mucous membranes and skin. Okay, mucous membranes and skin are going to be affected. So how to put the diagnosis that this fellow is suffering with coronary artery disease? See, I have shown you the coronavir, right? The reason why I have shown you the coronavir with this guy is because the coronary arteries are going to be affected, and that can lead to the myocardial infarction. Now, how to establish the diagnosis, right? See, there are certain criteria for establishing the diagnosis. This fellow should have fever for more than 5 days. See, inflammation, right? Inflammation leads to fever. So, fever should be there for more than 5 days plus any 4 of the following. Okay, so what are they? What are the any 4 of the following? What does I mean by is, look here. The baby should have the fever for more than 5 days. Along with that, what should be there? See, I have given you already a story. A kid less than 4 years drinking corona beer and riding the Kawasaki bike. Okay, this disease is Kawasaki disease, right? That's why the Kawasaki bike. And what he is going to do, he is going to make a crash. He is going to definitely cause a crash. So, now that's a mnemonic. These are the clinical features. C, R, A, S, H. So, C stands for what? The baby will develop conjunctivitis, mucous membrane. Okay. Conjunctivitis, that's going to be bilateral, non-suppurative. Okay, so bilateral non-suppurative conjunctivitis can be seen. R for rash, rash on the skin. Okay, there can be a rash, polymorphous rashes can be seen, and A stands for adenopathy. Okay, adenopathy, you can see the involvement of the lymph nodes. Okay, involvement of the lymph nodes can be seen, and S stands for strawberry tongue. You can look here on, I hope you can see this, the tongue which is looking like a strawberry, inflammation of the mucous membranes. Okay, strawberry tongue. So now itself I am telling you, later we will be discussing about the strawberry gums, that's a different thing. Strawberry tongue is seen in Kawasaki disease. And what is this H? H for hand and foot involvement. Hand and foot involvement. Okay, so the mucous membranes in the hand, and foot are going to be involved, and there can be a polymorphous rash can be seen on the skin, there can be conjunctivitis, adenopathy, inflammation of the lymph nodes can be seen, the mucous membranes are going to be affected, and there can be this strawberry tongue. These are the clinical features. Out of this 5, any 4 can be present. The fever more than 5 days along with any 4 of the following can confirm the diagnosis that this fellow is suffering with Kawasaki disease. And what is the most common cause of death? If someone asks you what is the most common cause of death, the most common cause of death is a coronary artery disease. Because the coronary arteries are getting affected, so that can lead to myocardial infarction. That's the most common cause of death. Okay, let me write it here. The most common cause of death is coronary artery disease leading to myocardial infarction. Can there be anything specific which is present in this condition? Not specific, I should say. Is there any other things which are going to be present in this condition? See, these fellows who are suffering with Kawasaki disease, they can have in their blood, they can have anti-endothelial antibodies. So, anti-endothelial antibodies can be seen. Okay. So, these are the points which I want you to know regarding the Kawasaki disease. Just wrap up. Kawasaki disease is going to be a pediatric vasculitis. It's going to be seen in those individuals who are less than 4 years or 5 years of the age. Most common artery is going to be affected is the coronary artery. Now, what are the clinical features? The clinical features are going to be the crash. C RASH. C stands for bilateral non-suppurative conjunctivitis. R stands for the polymorphous rash can be seen on the body. A stands for adenopathy. The lymph nodes can be enlarged. And S stands for strawberry tongue, and H stands for hand and foot involvement along with the fever. Okay, these are the clinical features, and the most common cause of the death is going to be coronary artery disease leading to myocardial infarction. Now, after this, we have discussed the polyarteritis nodosa. PAN is completed. That's the mnemonic is plan B. And the second thing is that baby who is riding a bike and doing a crash, that second thing is also completed. Kawasaki disease is also completed. Now, after the third vasculitis which I want you to know is Thromboangiitis obliterans, the TAO. Now, this TAO is also called as which disease? Is also called as Buerger's disease. Okay. Now, in this Buerger's disease, look, it is going to be seen in which individuals? Smokers, important. This is going to be seen in chronic smokers. Okay, those whoever the males, young males who are doing chronic smoking, in those fellows, the arteries can be inflamed. Okay, the arteries can be inflamed. So, let's write one by one. Now, it's seen in young individuals less than 35 years. Okay, it's seen in young individuals of 35 years of age, associations associated with heavy smoking. Okay, and it is also associated with a phenomena called as Raynaud's phenomena. Okay, it's associated with Raynaud's phenomena. Okay, so you can clearly see what is Raynaud's phenomena. Raynaud's phenomena is like the blanching of the skin because of the vasoconstriction. So, such kind of Raynaud's phenomena in the heavy smokers, if you are having the Raynaud's phenomena, yes, there is a possibility that these fellows are developing Thromboangiitis obliterans. Now, what are the important points which I want you to know? See, if you look at the clinical features are going to be intermittent claudication. Okay, intermittent claudication. The pain is going to be seen intermittently. The intermittent claudication is going to be seen, and very important point is, see, this inflammation in this condition is going to spread from arteries to veins, veins to the nerves. The inflammation in this condition, in this type of arteries, is going to spreading. Okay, so the neurovascular bundle. Okay, inflammation spreads from arteries to veins. From veins, the inflammation can spread to the nerves. So, the neurovascular bundle will be affected, arteries, veins, and the neurovascular bundle will be affected. But lymphatics, MCQ point which I want you to know is very, very important, that note the lymphatics are not involved. So, what else you should know? See guys, here I am showing you the thromboangiitis obliterans. The name itself is thromboangiitis obliterans. Angiitis, inflammation of the blood vessels is there. Vasculitis is there. Thromboangiitis. Angiitis means inflammation of the blood vessels. But what is a thrombo? Now, in this TAO, thromboangiitis obliterans, vasculitis is going to be followed with the formation of thrombus. The thrombus is going to be produced. Now, what this thrombus is doing? This thrombus is blocking the blood vessels. The thrombus is blocking the blood vessels. Okay, the blood vessels are going to be blocked with the thrombus. Whenever the blood vessels are going to be blocked with the thrombus, what happens? The blood supply is going to cut off. There is not going to be blood supply. Whenever there is no blood supply, what happens? Raynaud's phenomena can be seen because of no blood supply. Raynaud's phenomena, if it is severe enough, it can cause a necrosis. Okay, necrosis, and there can be auto amputation. There can be amputation of the fingers. That's the reason why you can see over here that the fingers are getting amputated because of the necrosis. Okay, so the point which I want you to know is, see, this image is demonstrating a vessel completely occluded by an inflammatory thrombus. Okay, so that's the reason the name is called as thromboangiitis obliterans. This thrombus is going to completely obliterate the blood vessels, and that's going to cause the amputation of the fingers. Okay, so let me write here auto amputation. Auto amputation of tip of the fingers. Okay, auto amputation of the tip of the fingers is going to be seen. Okay, so what are the important points which I want you to know? The important points which I want you to know is this thromboangiitis obliterans is also called as a TAO or Buerger's disease. Is going to be seen young males who are heavy smokers, and this condition is going to be associated with the Raynaud's phenomena. Okay, it's associated with the Raynaud's phenomena. The patient is going to have intermittent claudication, and in this type of vasculitis, the inflammation is not only going to be limited to the arteries, but the inflammation will spread to the veins as well as the nerves. The entire neurovascular bundle is going to be affected, but the lymphatics are not affected. Now, the name thromboangiitis obliterans, it suggests that there is the formation of the thrombi, and this thrombi is going to completely occlude the blood vessels. Because of the complete occlusion of the blood vessels, yes, the patient is not going to have a proper blood supply. Because of the not enough blood supply, there can be necrosis and there can be auto amputation of the fingers. Okay, so these are the points which I want you to know. And the next type of vasculitis which I want to discuss is Wegener's granulomatosis. Okay. Now question is, Wegener's granulomatosis, is it a large vessel vasculitis, medium vessel vasculitis or small vessel vasculitis? Wegener's granulomatosis, now we are entering into small vessel vasculitis, small vessel vasculitis. Okay, it's an example of small vessel vasculitis. I have asked you to remember Wegener's granulomatosis as a Wegener's. Why? Because Wegener's granulomatosis, it is associated with C and K in 75% of the cases. Okay, it's associated with the C and K in 75% of the cases, and in 25% of the cases, yes, it have P and K. It's a ANCA associated vasculitis. Now, it is also called as, this Wegener's granulomatosis is also called as granulomatosis. Granulomatosis means granulomatous inflammation, remember. Okay, so that is the importance. Granulomatosis with polyangiitis. Okay, granulomatosis with the polyangiitis. It's not only granulomatous inflammation, but it is also necrotizing inflammation. Okay, necrotizing inflammation of small blood vessels. Okay, now which sites are going to be affected? Most common sites that are going to be affected in this condition are nose, lungs, okay, and the arteries. That's what I mean by the arteries in the lungs and the kidneys. The arteries in the kidneys are going to be affected. So, nose, lungs and kidneys are going to be affected. So, because of the involvement of nose, lungs and kidneys, what are the clinical features that you will see? The clinical features which are seen in this condition are, because of the involvement of the kidney, let me write kidney involvement. Is there no? So, the kidney involvement is going to be crescentic glomerulonephritis. I hope you already know the crescentic glomerulonephritis is also called as rapidly progressive glomerulonephritis, RPGN. So crescentic glomerulonephritis is also called as RPGN. So what does I mean by? If a person or if an individual, for example me, if I develop this Wegener's granulomatosis, the blood vessels in my kidney are going to be affected. That's going to lead to rapidly progressive glomerulonephritis, which means within days to months, I will develop kidney failure. That's it. Within a very short period of time, there will be kidney failure. Okay, so that's the kidney involvement. Glomerulonephritis is there. Yes. Okay, so because of this glomerulonephritis, what can be there? This glomerulonephritis can lead to hematuria. Okay, because of this hematuria in the urine, you can see the RBC casts. Okay, there can be RBC casts. Now, what else can be there? Because of the lung involvement. Okay, let me write here the lung involvement here itself. So, kidneys are going to be affected. The kidney involvement is going to be rapidly progressive glomerulonephritis with hematuria and RBC cast. Because of the lung involvement, which clinical features are going to be seen? See, there can be cough, there can be dyspnea and hemoptysis. Okay, there can be cough, dyspnea and hemoptysis. So, in this condition, the important point which I want you to know is the patient is going to have hemoptysis as well as hematuria. Usually, most of the students, whenever they see hemoptysis and hematuria, they will think about a disease called as Goodpasture syndrome. Okay, in renal pathology, you will study that there is a condition called as Goodpasture syndrome where the patient is going to have hematuria, blood in the urine and hemoptysis. But not only that condition, a lung pathology, or I should say not lung pathology, a vascular pathology, a small vessel vasculitis, which is going to affect kidneys and lungs. In this condition also, the patient is going to have hemoptysis and hematuria. So, hemoptysis and hematuria is seen in Goodpasture syndrome, yes, okay. But hemoptysis and hematuria is also seen in a type of small vessel vasculitis called as Wegener's granulomatosis. Okay, and what else can be seen in these patients? See, the nose involvement is going to be there, right? What are the things which are going to be seen in the nose involvement? Okay, now let me write here itself. There will be perforated nasal septum. Okay, because of the involvement of the blood vessels in the nose, there is perforation of nasal septum. Nasal septum can be perforated and there can be runny nose, like runny nose can be there, perforated nasal septum can be there. What else can be there is chronic sinusitis. Okay, let me write here the clinical features. These are the other clinical features. The patient can have chronic sinusitis. Okay, otitis media can be there. Okay, inflammation of the middle ear cavity, otitis media can be there. And what else can be there? The patient, if you look, this is the patient who is suffering with Wegener's granulomatosis. In this patient, you can appreciate that the nose of the patient is having a depression, something like this. So, this is called as saddle nose deformity. Okay, saddle nose deformity can be seen. And if you look at the gums of these patients, okay, if you look at the gums of these patients, look here how the gums are looking. They are just looking like a strawberry. Okay, the texture of the strawberry. So these are called as strawberry gums. Strawberry, not tongue. Strawberry tongue is seen in Kawasaki disease. Strawberry gums. Okay, so strawberry gums are going to be seen in which type of vasculitis? Strawberry gums are seen in Wegener's granulomatosis. Now, just summary. Now let's discuss what are the important points which we have discussed about the Wegener's granulomatosis. Wegener's granulomatosis is the new name. The new name of the Wegener's granulomatosis is granulomatosis with polyangiitis. It's again necrotizing inflammation of the small blood vessels. Which sites are going to be most commonly affected? Nose is going to be affected with the perforated nasal septum is going to be seen. There will be saddle neck deformity can be seen. Okay, runny nose can be seen, and because of the lung involvement, there can be hemoptysis, cough, dyspnea can be seen, and because of the kidney involvement, rapidly progressive glomerulonephritis, which is going to be present with hematuria and RBC casts. This is one thing which you are going to see. And if you check the ear part, there can be otitis media, and if you look at the gums, you can have a strawberry gums. So all these are the important clinical features which are seen in the Wegener's granulomatosis. And remember, Wegener's granulomatosis is associated with which type of ANCA? It is associated with the C ANCA. Okay, it's associated with the C ANCA in 75% of the cases, and P ANCA association is going to be seen in the 25% of the cases. So with this, the second part of the vasculitis is completed. Now let's complete the other type of vasculitis, other type of the small vessel vasculitis in the part 3 of the video. Hope the video is helpful. Thank you.